all the doctors and Millennium batch. I'm very happy to share some of my experience and also whatever the little knowledge I am having in the field of Ayurveda, particularly to the general practice. If at all it is beneficial for you people also, I'll be very much thankful to you all. So, adaptation of the counseling in Ayurveda consultation and Ayurveda in general practice. This is what I'm going to share little bit knowledge about the counseling. So all of you may be heard already this wording. So as the competition is increased in the field of medicine also, and nowadays it is more of patient-centric approach rather than a doctor-centric approach. Nowadays, lot of doctors are available everywhere, so people are having option to choose their doctors as per their wish and desire. So the doctor has to be more relevant to the present updates and also the having the sufficient knowledge in dealing with the patient. And it's also nowadays very common that due to the day-to-day lifestyle changes, stressful life change in the society. So many of the diseases are not just organic; they are also nowadays psychiatric, psychological, psychosomatic diseases. So as a doctor, it's not simple just to patient come in, just inquire and send the treatment or write the treatment and send off. It is not possible. So you need to be more uh, in depth. You need to go into the patient's what their problem, and thereby we'll be able to understand whether it is psychological or psychosomatic or it's a psychiatric, so that accordingly you can plan the treatment. So, like whatever all of you may be knowing, like during the Kurukshetra, Arjuna get down from the chariot and said that I cannot get into the war. So that's what that Sandigdha Parasthiti he come across to face the war. Then Sri Krishna, that our story you know very well. What I want to say that in present day-to-day life and situation, the challenges everybody is facing, one or the other moment, all the people will come into that state of sandigdhata or the confusion of state, unable to take the decision. So they need somebody to guide them. Which one will be the appropriate way to go further? So the psychological well-being is very important, or the mental health is very, very important in present scenario. In Western countries, already people who are all having the mental illness or feeling the psychological some problem, they will go to the counselor or the psychiatrist or the somebody who can guide them and advise them further. But in India, still it is under the process of development. So it's very important for us also to be aware about adopting this counseling in our general practice so that we are capable of understanding the what is the root problem the patient is facing so that you can find a solution according to this problem. So next slide, please. Next slide, please. So, uh, so this is a very important reference available in Ayurveda about the diagnosis. So everybody will be expert in various field or in the knowledge. They may be very good in the identification of the medicine, plants, or the therapy, panchakarma, whatever in the field. But still, if the person is unable to diagnose the disease, without diagnosing, planning any treatment, it will not give the 100% cure. That's what being given reference given here in this reference. Rogam Madhav Pariksheya Tattvanandam. So reference I'm not going to read, that is there. So first and foremost is to diagnose the disease properly. Once the diagnosis is made properly, followed by that, whatever the treatment planning we are going to do, whatever the medicine we are going to prescribe according to the disease diagnosis, then we will be having 100% success. That's what being given in this reference. Next slide. Next slide. This is the interpretation of the same. I will not go into that. The total meaning is that first is diagnosed, then you plan the appropriate treatment. So as I told you, nowadays that counseling and the counselors, that stages are introduced in the consultation also. This concept is being already indirectly or directly mentioned in Ayurveda. By this reference, we can understand as the sloka goes, Jnana Buddhi Pradipena Yo Jnana Buddhi Pradipena Yona Vishati Tattvavid Atharusya Antaratmana Nasa Rogamsa Chikisati. This is if anybody may be well versed with the knowledges, but if he is not able to enter into the inner being of the patient or the belief system, Aturasya Antaratmanaha. So what is there in the subconscious mind or what is there in the belief system, that is very important for a physician to understand with the help of jnana and buddhi, whatever that knowledge and the wisdom as a torch, as a lamp. With that, you should be able to enter into the inner being of the patient and understand what is there in his subconscious mind or at the belief system. Then only will be able to treat successfully. If you are unable to go into the inner being of the belief system of the patient, we could not be able to treat successfully. That's what being told in this reference. So question comes here, what is this belief system? The belief system is either positive or the negative. So anybody having whether I can be successful or I can be unsuccessful. So if the belief system says that I am going to be successful and all the activity will go according to that and performance will be accordingly the preparation, implementation and the outcome will also will be in the positive sense. If a student is thinking that I cannot write a particular exam properly, I am having that I may fail in the examination. If that is his negative thought he is already having, automatically preparations will be less or the he may not be able to prepare well and in the examination he may not write it properly and the outcome of the result will be fail only. So whatever the diseases we are handling also, the superficially it may be reflecting something else, but his inner belief is having something else. If you are unable to understand what is the underlying cause that is rooted at the bottom, that is reflected as a particular symptom or a disease. If your doctor is unable to understand this, then you could not be able to treat the patient properly. That's what being told in this reference, Aturasya Antaratmanaha. So entering into the inner belief system of the patient or the person is very important to become a successful as a physician. Question comes here, how we can adapt this, how we can able to enter into the inner being of a particular person or a system. This is what we can understand in the next line. So, before getting into the what is counseling, previous slide, sir, previous slide, previous, yeah, next one, next slide, wait, here only. So here comes the counseling. So the definition is given, counseling is a consultation refers to the process by which a healthcare professional provides a psychological support, information or guidance to the patient and sometimes their family to help them to understand the illness, cope up with the emotional distress and actively participate in the treatment decisions. So this is what being explained as the counseling. So one who is expert in the field of counseling is called as the counselor, and one who is seeking some help from a counselor is called as a client. So this relationship happening between a closed chamber in a consultation room as a counselor and the client. So a counselor should have a specific qualities. Who can become a best counselor? That is what being explained in the next slide. Please, next slide. So here are the qualities of a counselor. So these must be one should have to become a good counselor. So here comes the first one, good communication skills. So good communication skills are nothing but the ability to speak to the patient the language they know well, or in a proper method, in a proper wordings, there should be a proper communication with the patient according to the patient knowledge. Being a medical guy, you know medical terminology, I can speak to the patient in that way means it is not effective counseling. So you must have a proper counseling skill that is very important to become a counselor. Then comes the rapport. Rapport is establishment of a communication, the relationship with the patient in a shortest time. So it's convincing that you know the patient for a very long time. Within a minute, the way, by the way of your talk, the way of your expression, the way of your body gesture, you will be able to convey to the patient that patient knows you for years together, so that he can freely able to express his difficulties or the problem when he is approaching you. That's what comes the rapport. Next comes the active listening. This is very important qualities of a counselor, which is required to become a counselor. Active listening means when the patient enters to the consultation room, when you are allowing him to express his problems or the difficulties, actively listening to his problem instead of looking here and there, using the mobile phone, looking at the watch, or not having the eye to eye contact, or diverting, or looking somewhere else, it shows that you are not interested to talk to him. So most of the psychological problem, just by listening to them, whether it gives solution or not is secondary, but they are having the suppression of their emotions. You are allowing the patient to express out their all the feelings or the suppressed emotion. That will be done by active listening. So just with the questions I'm going to tell, yeah, what made you to come over here? May I know your problem? If you put that question and allow him to speak out, when he's speaking, just look at into his eyes, look at his face, just listen to him. This will convey that you are listening to him and you will be trying to understand his problem. This convenience in the patient to feel comfortable to express his difficulty. That's what active listening. Next comes the empathy. Empathy is not sympathy, it is much more than that sympathy, where you are expressing the feelings as of the patient himself, whatever the patient is passing through the difficulty, that difficulty you are also expressing and you are also reflecting him back. That is what called as the empathy. So, if somebody is news you are reading, something happened, just you are telling, oh, so sad like that. But when you are speaking in the day, somebody comes to you and tell that, sir, I lost so much of money, or I lost the dearest one. My children are going to the college now. I need a lot of financial support, but my husband died. Like that, when they are expressing the difficulties or the problems, the doctor has to say, yeah, I know that you are passing through the very difficult time. I understand whatever the problem you are facing. Like that, speaking out will be expression of the empathy. A counselor should have the smiling face, that whenever you are receiving the patient, you must be having the smiling face. And patience is very important. Then lion-hearted, lady's finger, eagle's eyes, and the last one is the confidentiality. So when the client is coming to a doctor as a counselor, they may be having very sensitive matter, which may not be expressed to anybody, including their family members also. So such an sensitive matter they may be sharing. In such circumstances, it is your guarantee, you are assured that whatever the patient or the client is sharing that information will be kept confidential. That is what you have to assure to the client. If at all it is needed to be shared with the relatives or the father or the parents of the client, then alone it will be shared to them with the consent of the person. So expressing the confidentiality is very important in the counseling. These are the qualities of a counselor. Next slide. Then comes the stages of counseling. So this is how begin with the receiving of the patient. Please, the next slide. Next slide. Next slide. So this is how begin with the receiving of the patient, greeting the patient respectfully. So when the patient entering into your consultation room, just to say hello, good morning, namaskar, whatever you can say, and ask him to sit in front of you, offer the chair. And then if you wish to, you tell that, okay, you can have a water. If water is there, you can tell them to have the water. Just you can casual talk and ask him to sit. And you see the how his expressions are there, body posture is there, how he is sitting, everything is just we make him to be cool and calm and settled. Don't get into aggressively, what is your problem? Tell me like this, should not be started. So you just make him to be first comfortable and ease. Then the introduction. So self-introduction also in counseling it is required. What is your qualification? Which area you are expert. So in counseling also various specialties are there like career counseling, family counseling, geriatric counseling, child counseling. So many areas are there. In general also you can tell your specialty, what is your specialty, in which area you are expert, so that it will help the patient to understand whether he is approach the right person or wrong. So in that way it is self-introduction is important. Then the proper body language, then eye to eye contact should be there, and expression of the empathy already told, active listening. So this is how you have to begin the counseling in the initial. Please, next slide. So during the counseling, you need to understand the ICE. So I stands for ideas, C stands for concerns, and E stands for the expectation. While you start interrogating or inquire the patient, you need to understand the three components: ICE, ideas, concerns, and the expectation. This helps us to take the proper decision and quickly get into the decision of treating or how to handle the disease. So idea is about whatever the symptom or whatever the problem is having, what is thinking about that symptom. Somebody having the chest pain, and what is his idea? Or somebody having the headache, what he is thinking? So you may be thinking it may be tension headache, but the person may be due to that headache, he may be thinking that it is maybe a brain tumor. So that will help you to explain the patient in a proper way when you are planning for the next level investigation or the treatment. So you better to ask whatever the symptoms they are presenting and asking them what do you think about the symptom. That's what comes the idea. Concern about what is his worry about the problem. So that's what you need to understand concerns, what he experienced. Mother is coming with the child and what is her worry. So asking their concern about the condition or the problem. Next slide, please. Expectation. Next slide, next slide. Expectation is very important. Expectation is very important. That makes us to come into the quick decision for next what is the treatment or the action you can decide. So expectation, as you are listening to the patient, asking about the problem and what he expects from you. And when you what patient is expecting from you is when it's clear, you can very easily plan for the appropriate next level approach. Example, patient tell that expectation. Patient is having example many conditions. He is having the hypertension, he is having the diabetes, he is having the backache, he is having the joint pain. So when he is having when skin disease may be there, 3-4 diseases he is having. But patient is already undergoing treatment for diabetes or hypertension. Now he came to you for seeking the treatment for backache and the joint pain. So when you expect, ask him, what do you expect from me? How can I help you? If the patient say, no sir, I just want a treatment for the backache and the joint pain, then your next level of action or the treatment will be restricted only to the treatment of the backache and the joint pain. You no need to worry about the diabetes or the hypertension or the skin disease. So this helps you to focus on what patient is expecting from you, and accordingly you can plan the treatment instead of you know everything. I can try treatment for everything. It is not possible. When the patient is not interested to have the treatment for other condition, you no need to waste the time for discussing about the other condition of the disease. So direct question: how can I help you? How you what you are expecting from me, what is your expectation from me. So that's help you to focus on a particular, this is the proper investigation, diagnosis and the management. So after knowing all the eyes, and next will comes to the questioning. So when you start a patient inquiry, you have to adopt the three types of the question. So there will be open questions, closed question, and probing questions. Open question will be always at the beginning of the counseling or consultation. What made you to come over here? May I know your problem? Can you tell about your problem? So this will be endless. The patient, whatever the suffering he is having, he can begin with that, giving an opportunity for him to express what is the problem. That will be the open question. Closed questions will be answered by the patient in yes or no, or limited with the one word or the two word. How old are you? Since how long you are having the disease? Like these questions will be called as the closed question. Probing question, if any particular problem happened or the disease they are having, you are going in depth of asking how particularly that incident happened, when, where were you, how you were at that time. So this kind of the questions will come as a probing. Next slide. So after inquiring these questions and after knowing the patient condition by way of these questions and by way of talking to them, then comes the clarification. So suppose the patient say, sir, I have a backache and which radiate from back to the lower limb. It is there for the last 6 months and I need a treatment for this problem. So when you are going to put back to the patient same thing, so you came here to take the treatment, you are having a problem that the pain is at the back which radiate to the lower limb or the right or the left lower limb, and you want the treatment for this particular problem alone or whatever the other issues you are having, telling them to back to the patient and getting their confirmation. And this will help the patient to understand that doctor understood their proper complaint properly or whatever the problem they are facing, doctor is understood correctly. So this will come as a clarification and the summarization. So by making the summarization, you are making the patient acknowledge that whatever the problem he was having, for that reason he came to you as a counselor and he is confirming that doctor understood every problem he is facing. That will come as a clarification and summarization. Next slide, please. Next slide, sir. So after knowing the patient condition, you may go for, suppose the patient is having some particular symptoms and you will be deciding the particular investigation, or investigation already they brought it that you know very well, or you understood that this the disease is suffering, and you want to plan the uh, outcome of the treatment. So that comes the goal setting. The goal setting can be applicable for everywhere, anywhere. Even the student for writing the first year examination also, you will be setting this goal as a SMART principle, like the examination is for first year exam alone, and M is measurable, that goal will be passing 75% distinction, that will be measurable. And achievable means already some people have passed with the 75% above, that is achievable. R means relevant to the first year. Time will be 6 months like that. So this is an example I am telling for an examination. But for the disease also you can set the goal by discussing with the patient. Suppose a patient comes with the Kushta Roga and you are planning the Omana. You want to conduct the Omana for that. So that Omana is in the Kapade Kushta Roga, Urdu Jatragata, you are planning to conduct the Omana. So Omana is specific. The treatment before, during and after can be measurable, that is measurable with the symptoms or the change in the color, etc. You can consider that will be measurable. And in Ayurveda clearly told that Kushtaroga, Shodhana Chikitsa is recommended and it is achievable. And Kapalja Kushtaroga, Urdajatrigata, Omana to be conducted, that is relevant. And within a 15 days you are conducting the Omana with the full course of that, then time related, that is the within 15 days to 1 month. So this is how each treatment can also be planned according to the patient condition. It may be Omana, it may be Viration, it may be a Basti, it may be whatever. And even simple Samanosati also, you can fix the goal. Suppose Tamkaswasa or the bronchial asthma you are treating, You may be planning to do Vamana Virechana followed by the Shamanosati, and that Vamana Virechana is specific. The treatment before, during, and after measurable in terms of reduction in the symptom, and also the objective or the subjective parameters you can keep, and it is achievable based on the prognosis. You can decide whether you can treat or not. That is achievable or is relevant. Womanization can be conducted for a Kamkaswasa patient is relatable, and within 1 month or 2 months, the time duration. So this is how you can fix the goal for treating the patient also with the specific goal also. Next slide, sir, please. So this is how explain the patient proper, clearly the diagnosis, then nature of illness and the treatment plan. This is what I already told you, how you are going to plan the treatment, Romana, Virechana, Shamanosati, whatever. Then while explaining, use a simple language and check the patient understanding by using the teach back method. Ask them to repeat the plan of treatment, whatever you are told to them. Then discuss the possible side effects, alternative option, and self-care measures. So this is what being the end of the counseling. Next slide, sir, please. And after that also we can go for the follow-up and the evaluation. Schedule the regular follow-up and ask the patient to monitor the progress and reinforce positive behavior and adhere to the treatment. Modify the plan based on the patient response, and according to the improvement and feedback, you can change if at all any Shamanosati want to alter or change everything, you can do accordingly. And if it is a psychological problem, offer a continued emotional and information support. Next slide, sir. So this is about the counseling and adapting in Ayurveda consultation. I completed. Now I am focusing on the general practice, Ayurveda in general practice. When we were student, we are unable to find a lot of the medicines available very easily in a district place or in the state also. And maximum where kashayas or asavistas are very rarely in a one or two shops were available. But the trend nowadays, after the 25, 30 years, now we can see the change in the availability of the medicine. In every taluk, in every small village also, Ayurvedic medicines are available. And medicines of the Ayurveda now available as good as equivalent to the allopathic medicine in the form. I am telling about in the form. So you want the strip or tablet available. If you want in the capsule available. You want in ointments available, Ayurvedic liniments available, gel available, pain balm available, granules available that are similar appearance like any modern medicine. Anyone can prescribe this Ayurvedic medicine in their regular practice. So nowadays, when the government also proposing for the integrated system approach, they are asking the allopathy people also to learn Ayurveda, Ayurveda people also learning allopathy. So integrated approach also they are trying. So what I feel that whoever practicing some other system medicine, nowadays Ayurvedic medicines are very easily available anywhere and easy to carry, easy to take away also. You can, whatever the prescription you are giving, in that prescription, at least 2-3 medicines of Ayurvedic can also be added. I am speaking about somebody practicing allopathy or somebody. In that sense, I am speaking. So if you keep at least 150 medicines in our general clinic hospital, with that you can run Ayurvedic consultation also. If suppose if any prescription comes, 4 or 5 medicines we are writing. Out of the 5, at least 3 medicines you can write Ayurvedic medicine, which are similar to any of the allopathic form, tablet, capsule, gel available. So in that prescription you can add, or separate prescription you can give as an Ayurvedic medicine. So even allopathic medicine people are also writing many of the Ayurvedic medicines as a dietary supplements or the nutraceuticals like that. They are under that heading they are using. So why can't Ayurvedic doctors in their general practice, who are practicing in rural area or in allopathic, they can use Ayurvedic medicine in their regular practice also. That's what my intention. Usually the restriction follow 4 or 5 medicines. Then you can select one kashaya, one asavarista, one tablet, one churna, one oil external application. You can tell. generally whatever the Shamanusari I am going to explain in the next slide, kashayas will be recommended before food in empty stomach. The minimum quantity will be 30 ml. If it is concentrated one, added with the three-fourths of the boiled and cooled water for the kashaya, 2 to 3 times a day. Then for the Athavarishta, after food, 30 ml, 2 times a day. Tablet will be three tablets, 3 times a day, 3 times a day. The same capsules also can be given. If oils are prescribed, that is externally can be given. Churnas will be within 2 to 3 grams with the honey can be advised. So that's about the Ayurvedic prescription. 4 to 5 medicines you can add in the prescription according to the condition of the patient and the disease of the patient. You can make our own formula combination of the medicine and you can prescribe in the general practice. Next slide, sir, please. So here are the just for making you to understand the showing the some photographies where Ayurvedic medicines are same like modern packing, appearance, form, this is a drawing and some way complaining of and swelling, walking, etc.
So your voice is not clear, sir. Sorry to say that, sir. Sorry, sir. Your voice is not clear. We are not getting you properly, sir. Like there is a disturbance in
Yeah,
between.
yeah. No, it's not from echo coming.
Delegates, please stay to so that stay with us so that the problem will be solved soon. If anyone have doubt, you can ask till the problem is solved. No, Praveen, the screen is not visible. I think you can hear me. The screen is not visible.
Yeah,
Now
Praveen
it
sir.
is. Now it is visible.
Okay, sir. Next slide.
This
So
is
this
the
is
next one of earlier one, sir. This is the next one of earlier one. Ah.
okay. So the next slide. Next slide, sir.
Sir, maybe this, it is moving slow. Yes, yes, Praveen. Visible. Should we move to the next slide, sir?
Yeah, next slide, ma'am.
Just go and click.
Next slide, sir. Next slide. Yeah, this is the osteoarthritis. So patient will be having the joint pain mainly that will be aggravated after the activity or the walking, etc., and with the associated the swelling sometimes. And usually after the third or fourth decade or the 45, 50 years, people are coming with this joint pain. In our regular OPD, if you see 100 patient per day, OPD 50 patient will be having the Sandhigata Vata only. So this is a disease of joints, mainly Vata and the Asti. So Vata Prakopa taken place and Asti Ksaya. They are having the Asraya, Asraya Bhava. So pain is dominated and Asti Ksaya is there. So approach will be always Vata, Hara, and Asti Ruddhi. So you need to adopt that kind of the treatment in this patient. So usually nowadays, due to the lack of exposure to the sunlight, that is also one predisposing factor to have osteoarthritis. A lot of patients are having the vitamin deficiency, mainly D3 deficiency and calcium deficiency. The D3 and calcium supplements are available nowadays in Ayurvedic formulation or the medicines available. So whenever we're dealing with Sandhigata Vada, first two, three medicines should be Vata Hara. The next two medicines should be the Asti Vardaka. And external approach, the oils or the ointments can be recommended so that you can successfully treat this Sandhigata Vata. Suppose if somebody wants, just we want to have some external therapy means, you can go for the Janu Pichu or the Janu Tailadara. The Ksirabala Taila, Nirkundi Taila can be selected. You can do it, these two procedures. If anybody want to have a complete cure and Panchakarma approach means that will be in the form of Yuga Vasti, Kalavasti, Karma Vasti. You can go with the Anuvasana with the Ksirabala Taila. And the Niruvavasti will be Sagruta Kshiravasti. So that will be more recommended here. Sagruta Kshiravasti. So whatever the five components will be there in the Niruvavasti, Maksika, Saindava, Kalka, Sneha, and Kashaya. So in the Sneha, you can select the Uglu Tiktakam Grutam. And for the Kashaya, you can go for the Kshira. So here Kshira works as a, I think, Astita Vardaka calcium supplement, and Sneha works as a Vatahara. So this Sarvata Kshira Vasti works wonderful in the Sandhigata Vata treatment. So internally, any of the many medicines are mentioned here, but 4 to 5 you can recommend as a one prescription. Rasnadi Kashaya and Yogaraja Uggulu and the Simula Arista, Shirabala capsule, and externally Shirabala Taila. So this will be the ideal prescription. Rest you can select according to your understanding. And patent medicine nowadays, bone tonic is available, reassure tablet is available for the Sandhigata Vata. So this is the treatment for Sandhigata Vata. Please, next slide. So then comes the rheumatoid arthritis. So this will be usually AMA-dominated condition. So younger people are more prone to have this problem. Maybe 10 years, 20 years, 30 years, 40 in that group of people are having this AMA. So usually it is compared to the rheumatoid arthritis. So RAF factor you can advise for investigation. If it is positive, then you can consider it as a rheumatoid arthritis. So, Shodhana therapy could be Virechana and also Basti. So, Brosa Indavadetaila, Anvasana Basti, and the Vaitarana Basti is recommended in this rheumatoid arthritis. So, internally, Rasni Randadi Kashaya compulsory you can add. Then Simanada Gugulu is the choice in this Amavata. So, you can give this Simanada Gugulu. Then go for the Sunti Gruda, it is being recommended that you can select. Then the small aristic can give. Then you can go for the Nirkundi Taila as an external obstacle. This will be the internal medications in the Amavata management. So Ruma Yoga available, Rumalaya available, the patent medicines. Next slide, sir, please. Again, this is gouty arthritis. This is also one of the major diseases affecting the joint. So it begins with the greater toe, involving the greater toe, swelling, pain, and then it spreads to the other joints. Gouty arthritis, similar to Vata, and you can go for uric acid test. Uric acid high is there, you can consider the gouty arthritis. So Basti is also recommended here in this condition. If anybody interested, you can go for Basti here. So Mandisaric Saravasti will be more useful in this condition. So internally, Kokilakshari Kashaya available. Many companies are marketing that you can select. If otherwise, Amrutostarari Kashaya can be selected. And Kaishora Google is recommended in Vatarakta. Kaishora Google you can select. Then Balarista you can select. Then external application you can go for the Nidgundi Tela. So this out of the many medicines whatever listed here are all useful. But one restriction, 4 or 5 medicine in this order is sufficient. So Kokilakshari Kashaya, Kaishora Gulu, Desmula Arista, and one oil is sufficient as a prescription for the gouty arthritis Vatarakta. Next slide, sir, please. Then comes the sciatica neuralgia Rudrasi. So patient is having a radiation of pain from the back to the thigh, then to the calf muscles and to the foot. Either one side may be there radiation, or sometimes both the side it may be there. It may be Vataja, Vata Kaphaja also. So this is also require the Basti sometime, Basti treatment. So the Simula Niravasti or Erandamula Niravasti can be given in a regular practice. So internal medication, Rasni Randari Kashaya, Trayodashan Gulu, then the Dashimula Aresta, then we can go for the uh, Ashwagandha Churna with milk and Dhanvantaram Sahacharadi Taila as external application. So that's about the Dudrasi, sciatica. Many people will come with this problem nowadays due to this is also one more relevant with the Dudrasi, similar to that only Katigra. But in the sciatica, the Dudrasi radiation of the pain will be there from back to the lower limb, whereas in Katigra is localized only pain present at the back. So that is Katigra. Usually nowadays due to two-wheeler driving and this issue, the patient may a lot of people are suffering with this backache. So again, the medicine can be given in this patient also. Maharasana Kasai can be given, Rasa Gugulu can be given. You can go with the Ashwagandha Churna and lot of medicines also available, liniment available. Then Lumbatone capsule available. Lumbatone capsule can be given in this patient as a patent medicine. So next slide. This is one of the important disease. A lot of people are coming with restricted movement of the shoulder joint, are unable to lift the arm. So many people will come and tell I am unable to lift my this right hand or left side like that. They will tell. So once the difficulty in raising the hand and pain in the shoulder, so that definitely it goes as a apabhavuka, particularly frozen shoulder or periarthritis of the shoulder. So the moment is the patient is having this problem, you better ask, are you diabetic? So this will be associated with the diabetic patient more commonly in the diabetic patient. So it will be diagnosed based on the symptomatology of the presentation alone. So if the patient having difficulty to raise a hand above the neck region, backside and other thing, he can diagnose. The best treatment is here advising the patient to do the exercise. So exercise is very important in this frozen shoulder treatment. So ಕೈ ಮೇಲೆ ಎತ್ತೋದು, ಈ ತಲೆ ಹಿಂಭಾಗ ತರೋದು, ಬ್ಯಾಕ್ ಸೈಡ್ ತೆಗೆದು ರೊಟೇಷನ್ ಮಾಡಿಸೋದು, ಈ ತರ ಎಲ್ಲ ಎಕ್ಸರ್ಸೈಸ್ ಅನ್ನ ಪೇಷಂಟ್ಗೆ ಅಡ್ವೈಸ್ ಮಾಡಬೇಕು. ಸೊ exercise is compulsory. Without exercise, just advising treatment is not going to be much helpful. So it's also called as adhesive capsulitis. So there is a adhesion is there that you have to relieve by doing the exercise. So internally, Danadanyanadi Kashaya or Maharasnadi Kashaya can be given. Trevashanakulu can be given. Desmolarista. These three you can select. Then Shalaki tablet can be given. Nirgundi external application. Out of the 4 or 5. So usually in our general practice, we are advising 4 or 5 medicine in our regular practice only. So in that sense, I am advising. And if a diabetes associated is there, kindly ask them to take proper diabetic treatment. Next slide, sir, please. Then this is also another one like similar to Dudrasi. So instead of lower limb, the radiation of the cranial will be in the upper limb. So Iswachi. Radiculopathy or brachial neuralgia can be compared. So the patient will tell that from my neck to the right or left arm up to the fingers, the radiation of the pain will be there. Sometimes they may come with the numbness also. That is also associated with this radiation of the pain and numbness, and slightly weakness like that they may complain. So these will be the associated with the cervical spondylosis degenerative condition. So internally can give Prasaranyali Kashaya. This is a very important medicine in this condition. Prasaranyali Kashaya. The similar is the second medicine. Vatagidankusarasa available. Many companies are marketing. You can prescribe that Vatagidankusarasa. Then one oil you can prescribe any Vatahara oil. So that will be the ideal treatment for the Viswaj. Next slide, sir, please. Ardita is also one more Vata Vyadhi, instantly occurring. Many people may give the history that they traveled overnight by sitting next to the window seat, and when they reach the home, they notice the deviation of the mouth. So maybe they are suffering with the Ardita. So you can see the symptoms in this patient. So deviation of the mouth will be there, and unable to close the one affected side eye. Then Bell's phenomenon may be positive, rolling up of the eyebrow while trying to close. That may be the present. So that's about the Ardita. So Danadanayana Kashaya given, Balarista given, Vatagidankusarasa can be given. Then oil application over the face is recommended. So that is sufficient for treating this patient. So next slide. Again, Pakshagata patient, lot of people are coming with the paralysis. One more the major neurological disorder. So we can go with the Gandharvastadi Kashaya, Dasimularista, Ekanga Vedarasa, Vatagidankusarasa, and externally Mahanarayana Taila can be given. Now Vatapi capsule available, Palsineuron capsule are available that can be prescribed for the Pakshagata patient. So that's about treatment of Pakshagata. So next comes the diabetes mellitus. So this is one more lifestyle disorder, maybe due to the sedentary lifestyle or change in the food habits or consumption of the lot of rice and rice related items could be the reason for having diabetes. So I feel nowadays the trend also going on reverse diabetes like that. So proper diet advice is very important before giving the prescription to the diabetic patient. So I usually advise the diabetic patient to have ragi, then siridhanyagalu, then bittergourd, agalkai, then nuggekai, papaya, then amalaki. That is very important in the diabetes patient. Amalaki can be advised. Then this thing, turmeric powder with the milk is recommended. So this is avoiding of the rice and rice like dosa, idli, other items better to be avoided. And this is to be encouraged, ragi and the ragi products. Internally, Nishakatakadi Kashaya, if you want to choose only one Kashaya means you can go with the Nishakatakadi Kashaya. Then Nishamalaki tablet, we can prescribe. Chandra Prabhavati can give. So any of the three medicines enough, we can select any of the three medicine among these. So that's about the diabetes advice medicine. Next slide. Hypertension. So this is also one of the lifestyle disorder. Many people will come under. Most of the time asymptomatic also. That's why it's also called as silent killer. So many people are not aware that they are suffering with hypertension. So better to check the BP for all the patients routinely who are all above 40 years. So better to check the compulsory. So if at all that BP recorded more than 160, 170, according to the age also you have to consider. And if it is 160, 190, and diastolic pressure crossing 98 and nearing 100, so it will be a hypertension only. So rule out primary or secondary hypertension. So essential hypertension usually due to stress-induced psychological one. And secondary hypertension is due to some other systemic disorders. So rule out by proper investigation. You can go for lipid profile. You can go for renal function test. You can go for endocrine disorders. Then if it is not there, just go with the simple medication. So Sarpagandhavati available. Many companies are marketing. Sarpagandhavati can give. Arjunarista can give. Saraswatarista as a tranquilizer or relaxing the mind, you can give. Many companies are marketing HP code, particular company marketing. When they come up with a lot of patent medicines, particular companies earlier known for only traditional classical medicine, they are also having now patent medicines marketing also. So they have come up with the HP code tablet available for hypertension. So that can be used. And these are the medicines for the hypertension. Next slide. Next slide, sir. Again, next is the overweight or the obesity. So this is also non-communicable disease NCD comes under that category under the lifestyle disorder. So you look into the BMI, body mass index. So simple calculation is height in centimeter minus 100. Suppose somebody height is in the centimeter 160 centimeter, then minus 100. So expected body weight will be 60 kilos. If they are crossing this limit, then you can consider the overweight or the obesity. So, Guru Chakraparna told, so the food which are heavy for the digestion, but will not cause any santarpana again. So that kind of the food or the diet can be advised. Like halacine hannu can be more like it's more glucose related, not fatty. So it is heavy for the digestion. Fruits can be encouraged to take. The raw salad can be more advised for them to take. Then internally you can go with the Varnadi Kashaya. That one you can go. That second one you can go Navaka Gugulu. Then go for Gugula Chittakam Churna. You can advise the Gruta also. So Udvartana can be done in this patient. So next slide. So this is also one more lifestyle disorder, gastritis. A lot of people are nowadays traveling or moving or due to their job or profession, whatever. So they may not be able to have a regular food in time, missing the food or skipping or late taking of the food or consuming a lot of fast food, outside food, spicy food, non-veg. So this results in gastritis. So many people will come across this problem. So bloating of the abdomen, belching, sore belching, pain in the epigastric region, etc. will be there. So Indakanta Kasai can be given. Then Kamalubda Rasa is available. That can be given. As a Anulomana, you can go for Trifala Churna or even Vipatikara Churna can also be given. And Shankar Basma can also be given. So that's about the gastritis or amla pitta. Next slide. And then comes the indigestion with the polycythemia or Anadro, Shula, Parinam Sula like this. So another Sula, the consumption of the food, the pain will be increasing. So that is called Anadrava Sula, gastric ulcer. Parinama Sula will be duodenal ulcer. So that's about the gastric ulcer and duodenal ulcer. So you can go with the Chitrakari, Vati, Ingwastu Achaka Churna, Shankavati can give. So any of the three you can give. So remaining other thing you can decide according to your convenience. Next slide. So say similar to that only the peptic ulcer. So Chitrakari Kashaya can be given, Shankavati can be given. So Indukanta Kashaya. Next slide. So then comes the Kamala or the hepatitis. So you need to decide whether it's a Kostasrita Kamala or the Shakasrita Kamala with the proper symptom and also investigation. So your USC abdomen you can advise, and serum bilirubin you can advise. So you, and also viral hepatitis also you rule out. So accordingly you can decide the treatment. So Budichari Kashaya can be given, Patoloruinari Kashaya can be given in the Kashaya. So then Datri Mandura, Punarna Mandura, Shivagulika can be given. So Ipastikara Churna also be given. So that's about the E52 available, so many medicines available, so that can be given. Asthma is also one of the important disease we come across in our day-to-day practice. So simple, reduction of the pain from blind to grind with the burning micturition, dysuria, sometimes vomiting are the associated symptoms. So you just advise the USC of the abdomen. The reports say that there is a renal calculus present, then you can confirm the Mutrashmari. So treatment is very simple. You just go with the Brochari Kashaya, Punarnavasava, Bhukshuradi Gugulu. So that is the treatment for the Asmari. You can go for the patent medicine also, renal capsules available, cistone tablets available, that also useful in this renal calculus. So patient can be advised proper diet with the Kadali, Kanda, Swarasa, coconut water, barley soups can be advised regularly. So that's about the Mutrasmari management. Next slide. So this is also one of the common. A lot of people are come across benign prostatic hypertrophy. Mutrastila, it will be compared. So people will have this problem at the age of 60 years above. Frequency will be there, urgency will be there, very little when you pass it. They will wake up in the night also. That's what they will complain usually. So confirmation is ultrasonography. So this can be treated with the Saptasara or Sukmara Kashaya. Chandra Prabhavati is having good effect. That can be given. Then you can go with the Sukumara Leha also. Patent medicine, Prostavin available. Prostavin and Pinclasia tablet also available that are also useful in this BPH. Next slide, sir. A urinary tract infection is similar to Ushnavada. So a lot of people with either drinking very less water or doing a lot of physical work and having diabetes are more prone to have the urinary tract infection. This is Ushnavada in one of the Mutragata. It comes the same next slide also it is there. It is a Mutra Krishrata. There are more or less similar urinary tract infection. So for this again I can go with the any of the mentioned here. Brahmachari Kashaya is usually ideal. Then Chandra Prabhavati can be selected. Bhukshuradi Gula can be given. So this is the ideal prescription for this Ushnavata and this is a Mutra Krishrita. So next slide. This is what already I told you, UTI, urinary tract infection. Next slide, sir. So this is also one of the commonest, many people will come across nowadays, burning sensation in the foot. Usually, this is one of the complication associated with the diabetes. So many people will come across burning sensation, food and palm. That was usually in Ayurveda is called as a daha. So Pittahara approach is being recommended. So you can go with the Amritottara Kashaya or Manjustari Kashaya. You can go with the Vipatikra Churna. Then application, you can go the Pinda Taila. So Chandanasava can be given, Ustirasava can be given. Next slide. So then comes the Kushta Roga. So Ayurvedic doctors can also become the skin specialist also. So a lot of the skin diseases which are not treated by allopathy medicine also, we can have a wonderful effective treatment by Ayurveda. Many of the cases I treated in our regular hospital, the IPD patient and also OPD patient also. A lot of patients of psoriasis, eczema, lipoderma are successfully treated. So with the complete normal skin. So we have a photography before, during, after treatments also. So I feel this is one of the interesting field, very Ayurveda can assure more remedy for the skin diseases. So I advise all the doctors that can treat skin diseases in by Ayurvedic treatment. So a lot of medicines are available. So Manjustari Kashaya, Tiktaka Kashaya, Mahatikta Kashaya, Panchatikta Kashaya. Is very common, like broad spectrum antibiotic or something. So we can use Ayurveda in liver disease also. Grutas are very effective. If any of the medicines fail, you just keep the patient on administration of medicated Gruta. So Mahatiktakam Gruta daily morning in empty stomach 50 to 60 ml, you just advise them to take regularly for 1 month. So definitely it will give a good desirable effect. So you can give the patient on Gruta also. So you can give the Kadirarista also for the patient of the skin diseases. So externally also Marichari tail available, Manjistari tail available that can be used externally and lot of ointments are available nowadays. Please next slide. Sir. So this is what I told. Eczema patient will come in our regular practice with the dark skin with the sometimes oozing or without oozing with the blackish discoloration. That's what being similar to the Vichachika, eczema. So Mahamanjastari Kashaya, Kadirarista, Aragavardinavati, Nimbadi Kashaya, Nimbadi Lepa can be useful in this eczema. Next slide. Next, one of the commonest, many people are suffering with the liquid white patch. So, having very good improvement. So, internally, you can give Mahatiktakam or Manjistari Kashaya, and you can go with the Kadiraristam. Very interestingly, without forgetting, for Sitra, Bakuchi must be added. Avalagizari Lepachurna available. Or Bakuchi Churna also it is called. So that can be added in this externally and also internally. So this is about the liquid treatment and other medicines are there. Next. See that is the Udarda Kota. These are similar to the urticaria and allergic skin rashes or the skin diseases. So one of the best medicine is Manjista. Next will be Ridrakanda and Karivadesava. And Anulomana can be given regularly. So initially, sometimes 3 or the Tripula Churna can be advised to take regularly. So Manibhadra Buddha, Lena for some days is very effective. So that's about the article. Then psoriasis, I already told, lot of patients I treated in our regular OPD and in the admission also by giving the Panchakarma. Omana Virechana Bhakti and Sakradhara we have done. So patient got very good result with the same medicines that can be prescribed for psoriasis also. Next slide. Then this is also one of my very interesting area. A lot of people, especially respiratory diseases, particularly allergic respiratory diseases, are coming in the regular practice. One of the commonest is the bronchial asthma. Bronchial asthma, just keep the patient on regular rasayana therapy will be very effective. Without forgetting, you have to add rasayana. So if you go one to one kashaya, the simultaneous kashaya must be there. Then Kanakasava is the Asavarista, the second medicine you can add. Then third one, compulsory one Rasayana. Make sure that the patient is not diabetic. Otherwise, Chavanprash or Agastya Rasayana. Then Talisari Chuna, Swasakutar Rasa or Swasakasa Chintamani. So these are the ideal prescription. 4 or 5 medicine. Try to give it for the maximum duration. Definitely patient get very good improvement. Again, in asthma treatment, two categories are there. One, Ruddha, Balaka, and Balavana patients. So, Balavana around 15 to 20 years to within 40 to 50 years, they are required to undergo Sodhana therapy. Vamana Virechana recommended. Balaka recommended Rasayana therapy. Brahmana therapy is recommended. So, I advise you just keep the patient on Amaliki Rasayana or Chavanprash for a period of 6 months or whatever, maximum period. So Rasayana helps the immunity, increase the immunity once he grown up, so he will definitely recover from the bronchial asthma. Old age people, as you can, they are unfit for social therapy, just keep them on Shamanosadi. So whatever is here list is given, Shamanosadi, that can be prescribed for the old age people with the bronchial asthma. The next will be the same like Pittaja Klasa. So Vidaryadi Kosai can be given. Lakshmi Vilasa Rasa, Esti Mother Churna can be given. If fever is there, Amrita Resti can be added. Next slide. Then another one, spasmodic cough, as a dry cough. Again, Dashmula Kashaya. Then Sitopaladi Churna. Then Dashmula Resta. Next slide. Next slide. So Copacetic acid is similar to the chronic bronchitis. So patient can be given the Dashmula Kadasaya Kashaya and Swasa Talisar can be given and Kantakari Grutha can be given. Next slide. Next slide. Then another small people may come with the edema. So edema, you have to rule out whether it's a cardiac origin or renal pathology is there. All those things you have to rule out. And also Stanika will be there, Sarvadaika will be there, like that it will be there. So you have to categorize and understand the underlying cause. So you can go with the Punarnamadi Kashaya, Punarnamasa, Punarnam Mandura, then Gokshura, Churna can be given. So these are the medicines useful in this Sota. Next slide. Then lastly comes the, nowadays a lot of patients are having the Manasika Rogas or psychological problem and even psychiatric disorders also. So commonest will be the like Vishada, depression, anxiety, and also a lot of people will come with the Unmada, schizophrenia, such conditions also there. So for them, you can go with the Kalyanaka, Kashaya, then you can go with the Saraswatarishta, can go Kalyanaka Gruta, you can give Brahmi Rasayana can be given, Saraswatarishta can be given for these people. So other medicines also can be recommended. 4 or 5 out of this you can recommend for Mansika varies. Next slide. Next slide, sir. So here comes the last slide. What I want to impress and tell you that along with if somebody practicing allopathic practice, so try to keep the 50 medicines in their clinic, choosing which are the best patent medicines available, and whatever the prescription they are giving, 4 or 5 medicine in the one prescription. Out of that 4 or 5 medicine, try to add 2 or 3 medicine. Ayurvedic, they are similar to any allopathic medicine form only. So capsule you can write, tablet you can write, gel you can write, ointment you can write. So you can definitely confidently prescribe the Ayurvedic medicine and prove yourself that you are practicing Ayurveda only. So nowadays a lot of companies are marketing. Previous slide, sir. lot of companies are marketing. Yes, just for example, I try to show you the some of the companies and their marketing like Learn Kanda, HP Hari tablet, Amla Pitta Hari tablet. That is somebody having the Amla Pitta. I told them that people you can prescribe this. This is from Sitaram Pharmaceutical. Sapsiaticon is also one of the medicine for sciatica neuralgia. It can be used. So that's about the somebody. Kshira Gugulu is there. Chiravala capsules are available. So next slide, sir. Next slide, sir. So like this, Charaka also marketing pigmento tablet available. So that's for licoderma. So that can be Cefagrin for headache. Many people will have a migraine like that, so that can be used. So like that, Bipacil for the BP patient you can use. So that's also available. Redeemer for edema patient. So that's also available. So like this, Prozalan plus it is there. Projan shoulder I told like AVN. Servilan for cervical spondylosis. So you can use this Prostavin I told. Prostolan that is for prostate and enlargement. So next slide. Next slide, sir. So this is another company. They are also marketing these patent medicines which are available in the market. Next slide, sir. So this is also one more company marketing the tablets that can be used in our regular practice. So even previous slide, sir. Oil capsules also marketing. This slide is the Gandha Taila capsules, Kshiravala capsule, Sahacharadi capsule. Oils are in capsule form. So that can be also be used. Next slide, sir. Next slide, sir. So these are the other companies. Imis company, Isnofal. Isnofal, one of the medicine useful in the tropical eosinophilia like Vataja Kasa. So that is also having good result. So that can be used. So Nasoalarin is another one in allergic rhinitis. So and tonsuri for the tonsillitis, it is useful. Stomata for stomatitis. So this is also good medicine in Amla Pitta or Mukapaka, stomata. Next slide, sir. So with this, I thank you Millennium Batch for inviting me to share some of my whatever the experience I had